My name is Hollister Isman. I'm the state director for Rhode Island Working Families, and we've come together with a bunch of other organizations concerned about senior citizens, about people with disabilities, and about the people who care for them to form the campaign for home care, independence, and choice. Right now, in Rhode Island, 90% of elders and people living with disabilities want to be cared for in their homes. And that makes perfect sense. I think if most of us thought about that, that's exactly what we would want as well. Yet, finding home care is much, much harder than it should be. And far too often, many folks end up in nursing homes who don't want or need to be there, who could be in their homes and in their communities. We are about solving that problem. The coalition has come together around three simple principles. First, choice and autonomy. People who need services should be able to direct their care and choose who provides it. Second, accessibility and accountability. It should be easy to find home care options, and they should actually be available when you need them. And third, quality and consistent care. If we want a stable workforce of people willing to do this hard work, we need to train them well and pay them a living wage. The bill we've been working with Whip Goodwin and Rep. Blazewski to introduce advances these values by providing a registry of independent home care providers. These women and men would be trained and have their wages set and working conditions set by the state, but they would be hired and directed directly by an elder or his or her family member. Because they get to choose who they work with directly, individuals needing services have more autonomy. They can have someone they trust take care of them. By creating a registry with available and trained personal care workers, the independent provider model also increases the availability and the accessibility of home care. Because less is spent on administration, workers can be paid a higher wage with the same Medicaid dollars. It's not a new idea. 10 states have done it, and in these states, more seniors and people with disabilities are staying at home. Oregon, Minnesota, Washington, Massachusetts, California, and Illinois are respectively 1st, 3rd, 4th, 5th, 6th, and 15th in the percent of long-term care provided in-home and in community. Those numbers are up on that chart for those of you who are nerdy enough to want to pay attention to them. Rhode Island, by contrast, that does not have such a system, is 42nd in the country. This is a system that gives consumers what they want, and with more and more Rhode Islanders reaching an age where they will need these kinds of services, that's the other chart here, you can see this age wave coming, with more and more folks needing these kinds of services, that's a really big deal. It also saves money. By providing care at homes for those who want it, elders and people with disabilities can stay out of more costly institutions. In Massachusetts, which adopted a system similar to this, they have saved $1 billion, that's billion with a B, by doing this. It isn't often in work in this building that we find a solution that's good for consumers, that's good for workers, and that's good for the state budget. This proposal does all of those things.